red cord here is a representation of the tendon, which connects the muscle in the forearm to the bones of the finger. The tendon travels through the carpal tunnel and it travels under pulleys. The pulleys are designed to hold the tendon against the bone. So when you're closing your finger, the tendon stays against the bone and it keeps its mechanical advantage so it doesn't get bowstringing. Because if it gets bowstringing or it starts to pull away from the bone, then now the finger just won't bend because now there's no mechanical advantage. So watch when I'm doing this, it goes about that far. But if I pull this and it stays against the bone, now it can bend every hinge or every joint of the finger. But these are friction points. So you see where it's catching right there on my palm, where I have the white tape wrapped around in a ball. That's a callus on the tendon. So there's a friction, it's rubbing, it's gliding on that. It's like a rope on the edge of the table. And you keep sawing that rope on the edge of the table, that rope is gonna get hot, and, you can even make a fire like that out in the woods, right? You take a string and you spin the stick, and the stick makes friction and creates a spark. So all this friction, a callus forms, and it's catching on, one of the pulleys. It's called the A1 pulley. There's one on every bone that goes to every finger in the palm, and in therapy for conservative treatment, which conservative means not with surgery. So with therapeutic treatment, we can decrease the glide of the tendon, give that a chance to heal, use specific icing or ultrasound, and also cold laser, reduce the size of that nodule or the callus so it's no longer catching on the pulley. If if that doesn't work, and also injections sometimes are given to put steroid right in this area to reduce the size of that nodule or callus. Now, if everything fails and a person needs surgery, the surgery is to go under the skin and cut that pulley so now there's nothing for that callus to catch on.